Welcome to Granted in Style, and this is your host, Dr. Marsha Koger. So we have a lot that we're going to talk about today. We're going to talk about the coronavirus. And you wonder, too, what does this have to do with fundraising? What does this have to do with grant writing? Well, this is the time to think about it. A lot of teachers are off for the next 2 weeks. A lot of parents are going to be off. A lot of people are teleworking. So think about it. These 2 weeks, this is the time for you to actually do those dreams that you've been thinking about. This is the time to maybe do that trademark. This is the time to start that nonprofit organization that you've been thinking about. This is the time to, if you're a daycare center, there are a lot of people who have needs during this time. So if you're a daycare center, you might want to expand into a nonprofit organization. So during this time, if you want to do any of those things, I provide those services. Make sure you give me a call at 443-281-3856. So I have a great show that's planned for you today. We have a panel guest today that's with us, and we're going to continue a discussion that started from this morning. We have Dr. Donald Shell with us, who is a family physician as well as sports medicine. He's taught as well, so he's a medical doctor as well as a reverend. So welcome, Dr. Shell.
Thanks for having me.
Okay, great. Thank you. Thanks for coming. Thanks for joining. We also have his wonderful wife, Robin Shell, who is actually a licensed clinical counselor as well as an attorney. Somebody I've known for more than 40 years. Actually, I've known both of them for about 30 years, but well-versed, well-accomplished in their profession, and they're going to really bring some insight to us. So thanks, Robin, for joining us as well.
Thank you.
Great. And then we have Jessica Henson with us. Jessica Henson is 21 years old. She is getting ready to graduate from Bucknell College. She has a double major in film studies as well as creative writing. So she's going to bring her perspective. It's just important when we have these discussions that we really talk about the impact of things like the coronavirus with all generations. So we're going to talk with her as well. So before we get started with this discussion, I'd like to thank our sponsor. Our sponsor is Garden Co. So that's spelled GARDEN-N-CO. So Garden Co. does quality landscaping for homeowners and commercial developers. They do stone and deck solutions. So during this time, too, a lot of you are going to be maybe doing some things like sanitizing your house. So this might be a good time to go outside and take care of your garden as well. So call Garden Co. And you can reach them at www.garden-co.com. So that's gardenco.com. Also, one of our sponsors is Bronze Sites. They've been our sponsors since the beginning. This is my 4th show, so we're 4 shows in. So Bronze Sites is www.bronzesites.com. That's a second sponsor, www.bronzesites.com. So thank you for that. So we're going to get into our discussion now. Just a little backstory of why I wanted to talk about this. I work from home. I'm the executive director for a nonprofit organization, so I work from home. So this past week in particular, I have been obsessed with hearing about the coronavirus. All day long, I've been watching CNN. I'm a researcher, so I've been doing all this research on my own. And by Thursday or so, I was afraid. I felt scared, afraid. I was anxious, and I felt myself going into a panic. So I had to sort of take a back step. And it was Thursday, actually. Thursday, I spent the day and prayed because I was getting ready to go into a panic about all the coronavirus. How's it going to impact my nonprofit organization? How's it going to impact my own children? Actually, have been impacted. My son who goes to college in Virginia. So I had to kind of take a step back and really think about this. And I did. I spent Thursday just praying and reading the word and just getting some comfort because of being obsessed with all this research, all this information just being thrown at me about coronavirus was making me afraid and scared. And I was actually getting ready to go off track. So God kind of put me back together again. And so then I said to myself that if I felt this way, I know that other people feel this way. So I thought it was really important that I get on and talk about it. So I want to start with Dr. Shell, if you can really talk about what it is. Just, again, one of the things in doing my research, they've been calling it a whole lot of things. It was called COVID-19, COVID-20. They called it the novella coronavirus. So I think, too, it's important. There's been so much information that's going out. So I think it's important that we make sure this is accurate and we have accurate information. So what, from a medical point of view, medical perspective, what exactly is COVID-19 or the coronavirus?
So yeah, it's a great question. The coronavirus is one of the family of viruses. So all of us are familiar with the flu or influenza, which is a different type of virus.
Yeah.
But coronavirus is a family of organisms that we're well aware with in the country. Most of you have heard of SARS, was a type of coronavirus.
Yeah.
And the challenge with this coronavirus, as with the other coronaviruses, is that they are viruses that inhabit both people and animals. And so humans' immune systems have not seen this particular version of the coronavirus. The reason it's called coronavirus 19 is because it first began to cause human illness in 2019.
Okay.
So 19 just signifies a year. The reason they use the word novel is just because it's new to humans. And so the problem is when you have an organism like a virus that changes constantly, it undergoes mutations, it changes, and so when the virus changes, then the body's never seen that version of the virus before. That means there's no vaccine for that virus.
Okay.
There's no medication for that virus. There's no antiviral medication for the virus. And so it's just you, your body, and the virus. And it takes a while for the human body to develop the response in our immune system. And so if you're older, or if you're debilitated with a chronic disease, or if you're immunocompromised, then the virus overwhelms your immune system, which is why people die from the virus. So it's something new. We haven't seen it before.
Right.
It's novel.
Okay.
Coronaviruses have been around, but just not this version.
Okay, great. Thank you very much for that explanation. Also, just in this, they're giving instructions about how you're supposed to be arm's length. They're closing down venues. Even things like that were making me afraid, making me feel like, oh my gosh, what's going on? Can you explain why they're doing that? And do you think we're overreacting?
Yeah, I don't think it's an overreaction because a virus is a respiratory virus, which means it's transmitted by droplets, people breathing in the same air, coughing. Since there's no medication to treat it, then the only thing we can do is protect ourselves from being exposed to it.
Okay.
We're currently, whatever state of health you're in, you're in. If you've got diabetes, hypertension, heart disease, then that's just who you are.
Right.
So you can't change that to make yourself stronger quick enough to prepare your immune system. If you are healthy, keep yourself healthy, hydrated, sleep, exercise, some of the important things. But outside of any medical treatment, then you protect yourself by not allowing yourself to breathe in. Also, cleaning surfaces is good, but it's really not known whether or not coronavirus is transmitted by touching things.
Right.
But it's a good thing to clean anyway, so it's safe to do. But social distancing is a good thing, 6 feet away. So when you say arm's length, someone's got to have really long arms to be 6 feet long. But if you're 6 feet away, then it's less likely you're going to breathe in what the person is breathing out unless they're coughing or sneezing. So stay away from sick people. Don't go to crowded places. That's why a lot of events have been canceled. Anywhere where there's a lot of people within a confined space, we don't see it, but we're exchanging, organisms and things in the air all the time. And so I think it's the appropriate response, and I think it's going to help our country to minimize the impact of it in our society.
Great. Okay, great. Thank you. Ms. Jessica.
Yes, ma'am.
I'd like for you to share with our listeners, I know you had an experience this week, because of your experience, that's why you're here back in Baltimore. Can you share with us exactly what happened to you, and then really talk about, too, how you're feeling about it?
Okay. So, on Tuesday, my university sent out an email to faculty, students, and parents saying that they were going to cancel classes in person for the rest of the semester. So that was a very huge shock to me. I'm in my senior year. This is my last semester. I'm not even sure if we're having an in-person graduation yet. I was really ready to walk. It's been a long 3.5 years.
Yeah.
So I think initially I was feeling shock, and then I was feeling a little bit sad because there's a lot of people that have impacted my journey along the way, and I feel like I've had so much growth in these last few years. And there were so many people that I want to have the opportunity to thank and to say goodbye to and say see you later to. So initially I feel like there was a lot of shock, but now I think that everything happens for a reason. and I'm staying prayed up, and I just feel like I'm trying to see how this is an opportunity for me to do other things, and like I want to be a filmmaker and a writer, so these times that I'm off from school, like I can continue writing and be more disciplined in that. So I'm really starting to see it more as a positive. So me and everyone else that I go to school with, we have to actually move everything out by this Tuesday. They said, get your stuff, please leave campus. So for me, like I know I'm blessed and fortunate to be able to have Wi-Fi at home and the supplies that I need to finish up my schooling. But I know several people, international students that just are like in hard and difficult circumstances that don't have the resources that they need right now. And even my school online, so do we have that infrastructure to sustain online courses? Some courses you can't take them online. I'm a film major. I can't do film production and utilize my campus resources. And like, so I mean, there's just going to be like an adjustment, and we're all moving forward with that.
Right, that's a really good point. And right before this show, we were having a discussion about just how this is going to force us as industries to really think about how to consider doing things differently. Just being able to have your class online, that's something we should have done before, and we should know how to do. So it is going to force us to do some things differently and kind of push us in directions that we need to go in. I thought, just from an entrepreneur standpoint, I thought this would, if somebody does online, just think if that was your skill set and you helped transition all of these universities to get online, that could have been a business for you. So that's how I'm thinking too, and it's great. Congratulations to you. You're going to graduate soon, and you're going to make that important big film during this time. So maybe it might be a film about this. Who knows? But that's great that you've transitioned and thought about it in a positive direction. So Ms. Robin Shell, who actually is a licensed clinical counselor, what advice would you give to a younger person, or advice to someone who, like, I was anxious. Oh, I should have called you. I was anxious over those days. What would you like to say? And I know just the whole mental health perspective of this, I haven't really been hearing people talk about it. I did talk to somebody else I know, actually, who works here, who is 22, and he said this is the first time that he's experienced anything like this in his whole entire life. So he wasn't even sure how to process it at all. So from that whole mental health perspective, what would you say?
Well, these are great questions, because during this time period is so important. Even though you're physically away from your campus, it's important to stay connected. Many students will have their own Gmail accounts and things like that, but you also have a student account, and the schools really communicate through these established means of communication, and they're not as great with social media. So I would say just try to stay connected to your university through your official accounts, because you may miss something, and you already indicated you're very disappointed about graduation and what that may look like, and so we wouldn't want you to miss any kind of other official communication from the school. The other thing is to know how to access health benefits, because a lot of students were told at the last minute to leave campus, but some of them have their health benefits tied to the university, while some other students may have their benefits connected through their parents. So now that you're not in that state of your school, I don't know if it was Pennsylvania.
Yes.
So then you need to know and ask the school, advocate for yourself and ask the school, how do I access benefits like counseling and things of that nature? Because when you start feeling maybe anxious or depressed or angry, which are very natural during this time period because you're a senior, you're looking forward to graduation, you have projects you're probably working on for your film classes. So it would be very normal for you to experience any of those emotions, and so the school needs to tell you how you can access those kind of resources, which could be actually remotely. There's a lot of counseling being offered now online, and so you would be able to tap into some good resources on how to cope during this time. So I would very much encourage anyone at this time period who's going through something like you, and a lot of students have now been told they have to go remote. They have to do online classes. So I would very much encourage you to do that.
Great. Well, thank you very much. Also, if you have any questions, you can contact me. If you want to know any information about this, you can contact me. I'm at 443-281-3682. 3856. Also, you can contact me. I have a website. It's www.granted, GR8TeD, On that website, you can put your name, your email address, as well as what information you need from me. And during this time, since we're going to be working from home, I am available to do consultations. I'll be available online if you want to set up your nonprofit organization. I don't necessarily need to see you in person. You can call me. We can work on setting that up online. You can do your trademark online, as well as I do expect to offer some classes online during this time. So again, this is that time where you can start your nonprofit, where you can write those grants, those things again that I've been talking about over the last couple of weeks that have been in your heart. This is your time to do it. This is a time too that God has allowed you to be home, rest, and really do those projects that He has ordained or asked you to do. So again, I can be reached at 443-281-3856. Also, too, if you all want to give a contact number, and we'll continue this discussion, but you can reach Dr. Shell. Do you want to give your...
Sure, there's two ways to reach me. You can at 301-275-7171. And you can also go to donaldshell.com, and there's a contact page there. So just Donald like in duck, Shell like in gas station.
Okay.
So just think like you're going to get gas at the duck station, donaldshell.com. And then there's a contact page there. You put your name and number, and it'll email me and let you know.
Okay, great. Robin?
I'm at robinshell@rocketmail.com, and you can reach me at 240-472-9919.
Okay, and Miss Jessica, budding film writer and creative writer?
For now, if you type in Jessica Henson on social media, Henson is Henson, you can look me up and reach me there.
Great. So I want to, again, keep this discussion going. Robin, what advice would you give to parents? I know this is really impacting family. They have actually 5 children between the ages of 30 and 15. So I know as a parent, this has impacted you. What message would you give to parents that are experiencing this?
For parents, I would say be as supportive as possible. When students go back to school, as parents, we enjoy our freedom too. And so now the student is back home and they've been somewhat independent, and they've had this independence on the college campus. And so now we want to be supportive, but we also want to help educate them about what is coronavirus, what they should and shouldn't do, but not in a preachy kind of way, but in a way that is good information, and encourage them to get their information from reliable resources instead of social media, which you can't always verify those resources, the source of the information. So I would encourage you to go to your state or local health department or the CDC to get information about coronavirus and give that to your student who's home for maybe the rest of the semester. And the other thing I would is encourage any student who has been receiving treatment, mental health treatment, to continue with the treatment plans. This is so important right now because it is an interruption in your campus life, and so you need to have some continuity in your mental health care.
Right. Good, great. Thank you. Before this show, too, we were talking about today it's beautiful outside. It's 52 degrees. It's going to go up to 57 degrees. I saw people riding their bikes and just really looked like they were having a ball. So then I started thinking, well, during this time, can you go outside? I know everyone has been saying, let's stay away from crowds, but can you go outside? Is this a good time to connect with your family? My husband was talking about, who's here, Vernon, he was talking about having a picnic, that we were going to have a picnic outside as a family. So are we allowed to go outside during this time?
Sure, yeah, going in the outdoors and nature is therapeutic by itself. And so I think, going out in God's creation is a good thing. I think places where there's crowding, where there's a lot of people in a small space is not advised. But definitely going outside, getting some sunlight, getting a little vitamin D, and, enjoying looking at God's creation is something that will be beneficial for everyone.
Oh, great. Well, good. So we need to do our picnic, right? I wanted to ask you too. I've been looking at Dr. Shell and I didn't really necessarily talk about his resume, but his career includes practice in family and sports medicine, health policy, population health, public health, and private universities. He also has completed a seminary degree in biblical exposition. He has been on the faculty of Johns Hopkins the two of you all together, to me, you all are a dynamic duo, just a dynamic couple, because in terms of this issue, you can talk about it from a public policy point of view, you can talk about it from a medical, you can talk about it from a mental health. So I really feel if anyone needs some additional information or contact them, that I think they would be a good couple to really contact to get further information. In your, you've also been a missionary, just traveling, your international travels. Have you at all experienced anything like this, or have you had to deal with anything in some of the other countries that you've gone to, or what have you seen in terms of your missionary experience?
Yes, that's a great question. I think the similarities between the coronavirus now in the United States brings back memories of other countries that don't have the plethora of resources that we have in America. So here in America, we're accustomed to charting our time, controlling our time, buying what we want, going where we want. We normally go in the store and it's full of resources. You can get as much milk and, egg and bread. But I went in the store the other night and the bread shelves were empty. The milk was all gone. There was no toilet paper.
Right.
And from a missionary perspective, if you go to a quote-unquote third world country,
Right.
then you generally see things where you don't have the normal resources or supplies. And when someone in a remote country prays and asks God for something, there's truly no other resource for that.
Wow.
And so here now we're finding individuals that are not in control. And so the similarity for me is that many of us are experiencing what it's like to not be able to dictate what you do, when you do, can you do it or can you not do it. Now we're being told no.
Yes.
It's not available to you.
Yes.
No, you can't come in. There's not an option for you to come in the office and handle this. No, you can't access the things that you normally can do. And so that, for me, makes it like a third quote-unquote world country, where we're now not in control, but we have to remember that God is in control.
Amen.
And so then it allows us to be able to examine our faith
Yes.
and to be able to understand whether or not we're always depending on ourselves or whether or not we're depending on God. And if we find that we've been depending on ourselves, this is an opportunity to learn how to depend on Him.
Amen. Amen. Thank you very much. Amen. We get ready to kind of shout up in here. That's how I feel.
All right.
I want to thank you. Thank you for that. I want to, any messages that you want to, overall messages to our listeners, any encouragement? Jessica, you as a younger person, what would you like to say to other 21-year-olds, other people who are in your situation? Any overall message, any words of encouragement?
I would say be safe and stay positive, and in spaces where you can still do so, like maybe going outside for a picnic with friends,
Right.
still take advantage of that.
Yes.
Still live your life even though we're going through these unusual times right now.
Amen. Thank you. Miss Shell.
I would say stay connected as much as possible, even if it's through social media, through telephone. Don't go it alone.
Great. Thank you. And Dr. Shell.
Well, amen. I'd say one thing. Thank God for those of us that are able to work remotely. And so if you are able to work remotely and telework, thank God. Pray for those that are not able to do it. I think ask God how He would use you to be able to share the hope and the comfort that we receive from Him. Maybe be able to model that to others, because others need to know why we believe. And I think this is an opportunity for them to see the benefit of belief. And then we can share that and provide our testimony to others. So as they're going through the trials, they can maybe find hope and solace in the Lord.
Amen. Amen. And I want to add, too, that what kind of turned me around or got me back on my spiritual correct direction, I went to church on Wednesday night, and we had a service. My pastor, Pastor Don Lewis, and one of the things he really preached that evening is, are we doing the right thing in this season? First of all, to pray, what season are we in? And then to really ask God, what is it that you would have me do during this season? And I know I felt convicted. Like I said, I was hyped up, getting ready to get really anxious. And That was Wednesday night. And then Thursday, I just cried and laid on the floor. And I said, God, forgive me. I felt like I had gone off track. And I did. I said, God, let me know, what season are we in? What season am I in right now? And what would you have me to do during this season? So it's really important that we stay connected to God. We stay connected to Him during this time. Get back on track, or stay on track, get on track with what He would have us to do. And again, during this time, I'm available to talk. You can call me at 443-281-3856. And you can do, again, that nonprofit. We can do it online. I can do some teaching with you online. Call me. Go to my website, www.grantedinstyle.com. That's GR8 TeDinstyle. Anything? I have a studio full here. Anybody want to add anything, Mr. Koger? He has been great support during this time. He actually is going to be probably teleworking. He's with the state government. So my whole family is going to be home with me during this time. I have my son Lawrence, who's a special ed teacher, so he's off for 2 weeks. My husband's going to be off for 2 weeks. But it's funny because the interesting about this for me, though, is, again, I work from home already. So I've been home for the last year and a half. So I might not be home. So I might be outside in the backyard. But it still is. It's just I think it's going to be a good time, a time for us to really do some planning. If it's that book that you want to work that you haven't had a chance to work on, it's your time to write that book. I can help you with that. I know how to do your copyright. So, Mr. Koger, anything you wanted to add?
No, I would just say this is a good time to hit that reset button. So any desires that you always wanted to pursue, you can go ahead and do those things. Anything that you have hobbies and things that are good hobbies. When I say good hobbies, in terms of space, you got to be aware of that. But I think it's a good time for us to do some activities and just to realize that God has created us on this earth to do things, extraordinary things, and just allow God to move in your life. And that's all I really wanted to say.
Okay. Amen. Thank you. Thank you. So again, you can call me. My number is 443-281-3856. Again, you can go to my website. It's www.grantedinstyle.com. Again, I'm going to be offering some online classes. I can work with you one-on-one as a consultant, one-on-one, to really help you birth those dreams and visions that you've had in your heart for the longest time. So this is your time to do it. Again, write those grants. Again, if you want to talk to the Shells, again, Donald, if you want to give your information again, Dr. Shell.
You can go to donaldshell.com or 301-275-7171.
Great. And Miss Robin Shell?
Robin Shell at Rocket Mail, 240-472-9919.
And Jessica?
You can look me up on any social media. My name is Jessica Henson, last name Henson.
Great. So thank you so much for tuning in and joining us. I hope we were able to give you some information. I like to end with, this is something my husband said a couple of weeks ago. Amen. Usually at the end of a sermon or service, or even if you're in service, you usually say amen.
Amen.
So amen, which stands for agree with God, move with God, in with God, and never doubt God. Amen.
Amen.